that we are hoping to be able to reach out and have programs that are available in dealing with that particular aspect of it. So I'm just going to go through some slides. I want it to be as informal as possible. So either send in questions through the chat line or mention them, and I'll make sure we leave time at the end for some conversations. I love this quote by Joan Borisenko, and it kind of sets the pace of where we're at. We in the care partnering communities frequently encounter people with life-threatening illness, and I would throw in bereavement or trauma, at a point when they are no longer who they have been and are not yet reborn into who they will be. We meet them in a place between no longer and not yet. No longer and not yet. That is so difficult for ourselves when we're in that journey, so difficult for the clients, patients that we might be working with the community groups, but also very difficult for us. So there's always that two edges of the sword, that we have really excellent and compassionate care programs for the people we walk with, but also for ourselves in dealing with that aspect. If you ever get a chance to read any of Parker Palmer's stuff, he's dedicated his whole life to educating and supporting teachers. And so the beauty of YouTube is you just go on YouTube and you can listen to pretty well any talk he's given. But he says this: one of the hardest things we must do sometimes is to be present to another person's pain without trying to fix it, to simply stand respectfully at the edge of that person's mystery and misery. Wholeness does not mean perfection. It means embracing brokenness as an integral part of life. Misery and mystery, those are the two themes that I see continuously. And it's important that we kind of focus in on those that can make that really helpful. So misery is when someone is, in the midst of a bereavement or been told they have a palliative diagnosis. And then that sends that whole question on what is that affecting their meaning and purpose in life. And unfortunately, we really weren't skilled and taught and raised to dive into the topic of meaning and purpose in our lives. So often it's a new journey, new doors that we are opening. And that's where mindfulness, we're learning so much about mindfulness, of just stepping back without judgment, with a lot of self-care and compassion, to look at how this misery is affecting our meaning and purpose. And then that leads to mystery. And I don't mean mystery in the religious sense. I mean mystery in the sense of, how is this misery, as I reflect on it mindfully, which gives me an openness to the topic, is affecting meaning and purpose, and what develops out of that. That's the mystery that we deal with. And then the last word is mastery, and that's for ourselves, making sure that I always said I'm only as good as the journals I read, the workshops I attend. So practicing our skill, refining the art and skill of what we do to make sure that we have caring, compassionate communities to reach out as we reshape what grief and what bereavement is in dealing with that particular aspect. And again, we're learning so much about trauma-informed care. I think it's just been the last 5 years that trauma-informed care has come out. And as I reflect on it and learn about trauma-informed care, I realize how damaging many of my interventions were 20 years previously, where we just didn't know about this aspect. And I many times was re-traumatizing a lot of people as they came into the office, or I went into their homes around that. So that our programs need to be based, and our communities need to be based on that resiliency and a recovery model, that we believe that you have the ability to integrate the loss, the trauma, and be able to learn from that particular aspect at your own time, at your own pace. How it is interpreted to you is so important around that aspect. Making sure that compassion, and it's a dependable program. So I really try not to cancel any appointments Um, that backfired once, but I got, it was a real good learning experience. I had a young mom who had experienced the death of a child. And it was right in the height of, after about 10 sessions. So we were really getting into some real difficult feelings. It was about 20 minutes before the appointment, and I felt really nauseous. Um, my office, family health team, was above a drugstore. So I heard Gravol fixes that. I didn't want to cancel the appointment. I went down, got some Gravol. I'm Gravol naive. I never took Gravol. I took it and it settled my stomach almost immediately. And so I'm talking with her, and all of a sudden, in mid sentence, my head snapped. I didn't realize it made you drowsy, but I didn't see it coming. It's not like I was yawning. It just, my head snapped, and then I was kind of horrified. I didn't think she saw, so I didn't say anything. And then the next session, I said, I need to come clean. I need to apologize. I really should have canceled. I told her the story of being nauseous, taking Gravol. And she was, oh, thank God you said something. I thought that my loss was so minuscule that my therapist is falling asleep. It's that kind of making sure that we are honest and upfront in dealing with that aspect. That our programs are culturally sensitive, and I'm so grateful for our First Nations people, our brothers and sisters that have come forward continually and continually trying to educate us about the plight of First Nations. So making sure that that program, so trauma informed, is so important. And then we reform our bereavement programs to our community. We need to make sure that they're dealing with that aspect. Pema Chodron's a Buddhist priest. She has a retreat center in Halifax, and she says this: the truth you believe and cling to makes you unavailable to hear anything new. And I'm shocked after 43 years of this in this business, how I still have those blinders on. And it's good to be honest and to be aware of those blinders, but it's so good to have really good colleagues, to have really good friends that kind of tap you on the shoulder and kind of point out where the blinders are getting in a little too tight around that particular aspect. So this is a timely topic because I think we're all completely exhausted from the pandemic, and seeing now that it's affecting going into another phase makes that really difficult. So the root word, the root word for bereavement means to be robbed. And that's a perfect word. We are robbed of so many things around that aspect of it. And so what we found is that when the nursing homes and hospitals were shut down and deaths took place, people had to say goodbye through FaceTime and Zoom meetings, and how difficult that was. Hospitals, long-term care facilities, hospices were shut down, and people were saying goodbye outside windows around that. The restrictions of funerals and visitations, again, really rob people of that healthy grieving and dealing with that particular aspect, which has led to an incredible amount of grief overload. I have a 6-week little old grandson that just got out of Children's Hospital. He had RSV. Now, again, 66, I've been kind of out of touch with childhood illnesses. And when my daughter said, would you mind checking to see if you can pick up some Tylenol or Advil for kids? And I was horrified when I went into 12 pharmacies and the shelves are completely empty. It just gave me an experience of how empty, that was a great metaphor, how empty many of us are because of all of what COVID has happened in dealing with that aspect. And so COVID definitely was a disaster, a national, worldwide disaster. And what we know about a disaster is you have that pre-disaster where you start to prepare. Well, we didn't get much warning about preparing, and there was so much misinformation and misunderstanding of information that we didn't get a chance to prepare. And then you have the impact. You have all these heroic stories of how people are overcoming the natural disaster. There's a honeymoon phase, then a disillusionment, and then you start to be the reconstruction. And this usually takes place over a couple of months. of a disaster. But we never had a chance for that. Um, you had the wave one, wave two, wave three. I think we're at wave nine right now. So much of the honeymoon was postponed, or there was very little time for that, or reconstruction, very much in the disillusionment phase right now because of it lasting so long. So this is really important to us to be aware of why it's such an impact on us, and why maybe our community programs need to be prepared for that particular aspect. So what we know at a time of stress, uh, we have that the two ends of the continuum. You kind of rust out if things aren't challenging enough, or burnout when it's too much. So we all have that comfort zone, and every once in a while, because of deadlines or extra things to do, or a minor illness, we're asked to stretch a bit, and we can do that for a while. But if it lasts too long, we then get into that zone of disillusionment where the strain and the overwhelmed. And after almost 3 years of a pandemic, that's where we're at as individuals, many of us, as programs, as teams, as communities. So that's why it's important to be aware, and then to be able, and since this is so new, to get really creative on dealing how to deal with some of this particular aspect. So we know with short-term stress, um, it kind of peaks. You have that bit of a recovery period, and then you go on to normal functioning. Well, long-term stress, it's those different waves, the events, the more events, continued events. Knowing now that all the hospitals are maxed out with beds, um, and RSV and influenza is peaks in January and February. So already that kind of turmoil of dealing with that. And then the recovery period is much longer. So this is should be over a 3 or 4 month period. Over 3 years, our recovery period is going to be much longer in dealing with that aspect. So as a community, we were just not ready for this kind of grief. Um, I was deployed to one of the nursing homes in Northern Ontario, that all the nursing staff had COVID, were very, very ill, and we had 26 deaths in 5 days. We stayed in a spacesuit pretty well the full 6 days that I was there. And my first death, I knew very little about FaceTime. And there was a granddaughter, 21 years old, saying goodbye to her grandmother. And she instructed me, she goes, "Can you just put your iPad up to my grandmother's face?" I said, "Sure." She goes, "Now, can you just kind of squeeze it against her lips?" And I did. And she took a screenshot. I didn't know what a screenshot was. So afterwards, she explained what she did. I said, "Could you send me a copy of that?" So I saw she now has a physical copy of her kissing her grandmother. And I asked her, I said, "Can I have permission to do this?" So I did that for the next 25 deaths. And I thought, oh boy, this technology, thank gosh we have it, but it was really helpful. It can be helpful in dealing with that aspect. So all our beautiful rituals that we have in long-term care facilities, hospices, and homes were really robbed of that whole experience. So what we know when we reshape our programs about grief, there's many kinds. There's that cumulative grief. My dad died about 4 years ago, and I took the compassionate leave program, and I wasn't sure when to take it. Do I take it early or do I take it later so I can be more of a help? And I remember talking to my dad about it. He said, "Just come." And so I took the 8 months, and I had about 4 or 5 really good quality months before he started to get ill, where then you just provide really good physical care. But that was so helpful. So for any of you, if you have opportunities to take the compassionate leave program, keep doing it. CHP, the Canadian Hospice Palliative Care Association, started that about 35 years ago, and it's now in its fruition. They budget about $200 million a year. About half of that's being used. I wish that they could take the other half and make it longer for people around that particular program, which is just really helpful. So if you're working with clients or for yourselves, take it early. Feel good about taking it, And it's because, again, the pressure we have to be working, to be useful. There's something about the power of your presence, of being with that person. But during my dad's death, I was shocked at how we reworked my mom's death when I was 19. So that would have been some 48 years previously. So that's that cumulative grief. So not only the death, if there's been multiple deaths, but how it's affected, how COVID has affected our workplaces, our home environments, our schools around that. Very much anticipatory grief. If you have time to prepare for that, you work through. And a lot of people say, what's harder, a sudden death or an anticipated death? Well, I think with a sudden death, you have a lot more energy. You haven't been sitting at the bedside for 2 months, 3 months, 6 months, and you've had an opportunity to say the goodbyes with an anticipated death, where you don't with a sudden death. So really, it's 6 of one, half a dozen of the other. Grief is grief, and there are different aspects of it. There's chronic grief where the grief just continues and then often can turn into complicated grief, and then collective grief. I think of what's going on in the Ukraine and feeling pretty helpless about it, but knowing that along with COVID, sick grandkids, there's this collective grief that I am carrying, that I know many of us are carrying around that particular aspect. That's really important to be aware of. So whatever programs you develop or encourage groups to develop is making sure that they're acts of emotional caring. And that's where I always say, never underestimate the power of your presence. I had a bereaved dad say to me the other day, and a bereaved wife said, I just so much crave physical touch, like just a hand on the shoulder. I know we can't do that today, but I'm just craving some physical touch while I go through these multiple losses around that aspect. So making sure that our we can compensate for no physical touch, that we're giving really good emotional caring, along with emotional support around that aspect, very much coupled by instrumental support. There's something about the casseroles outside the door are really helpful, saying, I'm going to come over Tuesday and do your laundry for you. You can do whatever you want, that whole aspect. I worked with a gentleman who was a hockey coach, 11 and 12-year-old boys. And he was getting treatment that took 2 years. And this hockey team cut his grass and shoveled his snow. They created a schedule. The schedule was online. So whenever they could see an opening, and that's how they provided that instrumental care while their coach was experiencing that aspect of it. And then appraisal support, making sure that there's that sense of connection. And this is where our communities are really helpful. Windsor has a fabulous bereavement program that CMHA Essex Windsor has done. It came out of the tornado that happened a number of years ago, where 9 people were killed, many seriously and critically injured. And they created this incredible bereavement program that's one of the best in the province. And they've now added one for teens, children and teens, and there's no wait list. There's nothing worse than having to get some services and put people on the wait list. We know that when people are ready, you strike when the iron's hot, and that makes it wonderful. And there's no government funding. They're funding this themselves. So that's where that whole creativeness is just wonderful in dealing with that particular aspect that can be helpful. Okay. Okay, I'm just going to stop sharing for a minute because it's kind of frozen, and I'm going to redo it. Oh, here it is. Let's see. It doesn't want to move. So I think what I probably have to do, I will stop sharing. Just give me a second. Maybe while I'm looking at any comments, questions, well, I'll go ahead and find this. Comments or reflections?
Please feel free to ask questions in the chat, or you can unmute yourself and ask a question directly. Mariana, did you want to ask a question? Yes, Mariana, please. We can't hear you, Mariana, if you're asking a question.
Yes, go ahead, Mariana. We can't hear you if you are speaking, unfortunately. Do you want to try using the chat?
Mariana, we see your hand raised. Please ask your question or make a comment if you would like to. Or if you would want to use the chat function, please use the chat function.
Okay, well, while we're getting that question on, so what practically can we do reshaping community response to grief and loss? Well, first of all, continue to be aware of the effects of COVID-19. People are just starting to think about having memorial services for loved ones that have died. So there's been a lot of delayed grief. So making sure that our programs, our community organizations are aware of the impact of delayed grief. Encouraging, finding ways of supporting and getting the notion or the information out there about face-to-face groups. There's a lot of funeral homes are now doing it, churches are doing it. So organizing that so that people have that. It's not until you need the service that you're aware of it. So just like I had no idea there was a shortage of Tylenol and Advil for kids until I was in that situation. So making sure people have that kind of information around that. I really feel there's a role for grief groups virtual. Often in those early days of grief, people don't have the energy to get out. And so ideally face-to-face is the best, but may not be. I mean, there may be a benefit of our virtual groups around that. And that's the beauty about the Windsor's bereavement program, is that there's this sustainability built right in it, is that after people have done the groups, they often get hooked up to one-to-one support. They then take training to be companions, mentors. They co-facilitate groups. And that's what's going to be dealing with that. My sister worked for CMHA and the bereavement program, and her bereaved parents would say, and if they had the death of a baby in the hospital, they were given those plastic belonging bags to put in all the special things that they received in the hospital, blankets or caps or nighties. And it was just demoralizing, the plastic bags. So she went to all the woodworking shops in the high school and asked the tech teachers, could they make this memory box? And they said, sure, we can do it. We don't got any supplies. So she went to all the cabinet makers and said, I just want your scraps. And a volunteer would go get the scraps. And they needed about 60 boxes a year dealing with that. But the beauty of it is that 4 times a year, she would go into the classes and teach the kids that they were making the boxes what this was about, a way of educating. So we really need to, again, continue to get into our schools that can be helpful. There's things we can do to sponsor grief groups that can be helpful in dealing with that. Go online to the Canadian Virtual Hospice. They're trying to create a national bereavement and grief strategy. So there's professionals in academia and in frontline work that have put together this national strategy where around that. So when we just look at how much we've been able to do with the mental health strategy, and they were given $100 million to create a national strategy. And their first thing was to break the stigma around that aspect of it. So eventually we hope to see more trickle down into hardcore funding that can be really helpful. Again, making sure that we have grief supports in our school system, and then individual grief support for the bereaved, making sure that those programs are available and that we know about them. To say to somebody that's grieving, just give me a call anytime, isn't really helpful. We need to be proactive. That can be helpful in dealing with that aspect. I think our programs need to very much be evolved around some principles. And I love the work of Dr. Alan Wolfeld. So one of them is his companion model. It's about being present to another person's pain. It's not about taking away. It's about going into the wilderness of the soul with another human being. It's not that you're responsible to finding the way out. It's about honoring the spirit, not necessarily analyzing by the mind, listening with the heart, so that you can really be heard. You know, we are trained to listen to respond, not listen to understand. It took me about 5 years to break myself out of that habit of dealing with that. It's about bearing witness to the struggles of others. It's not about judging or directing those. It's about discovering the gifts of sacred silence. And that's the beauty. Some people will say, oh, I don't go to funeral homes because I don't know what to say. You don't need to say anything. You just need to be there. It's about being still. It's about respecting disorder and not feeling you have to impose some kind of logic. It's about learning from others. And it's about that compassionate curiosity. When I was at the family health team, I was getting these incredible, wonderful evaluations. And so my manager said, how come you're getting these incredible evaluations? I said, well, it's not because of my skill level. I've done a couple of things differently about 5 years previously. Before I go get anybody into the waiting room, I say to myself, what am I here to learn? And then immediately, instead of being like this, you're like this. I stopped taking notes during a session. Now, you have to be really structured at that. So I made sure that I would do a note right after. But as soon as I'm talking to somebody and then I go like this, I'm disconnected. So those little practical things around that can be really helpful. And at the end of a session, I'd say to them, okay, now I need to do a note. Can we do it together? This is what I kind of learned from the session. Did I get this right? And this is what I think we should maybe talk about next week. Or did you have some other ideas? So it was a much more empowering session around that. And therefore, the positive evaluations, because I was much more aware of what I needed to do and what they were all about in dealing with that. You know, despite the PPE, we still can connect.
Thank you.
That.
Eugene,
Yep.
can I just give you a 2-minute kind of warning?
Perfect. Yep.
Perfect.
Thank you very much. I was hoping you would do that.
Thank you.
I love this. The soul speaks truth only under quiet, inviting, trustworthy conditions. So that's what makes that really helpful in dealing with that aspect. I will pass these slides on so that all of you get the copy of them, because there's a bunch of other information that you have that I wanted to. I just wanted to mention Christmas is coming up. So make sure you either structure your Christmas or free will it. You might need to be more spontaneous. Make sure you include rituals, change up your practices that you had, build in time for reflection. Christmas is a loaded time. Sometimes service for others can be helpful. Make gift giving really simplistic, and look for community events for the bereaved. That can be really helpful in dealing with that aspect.
Do you have any numbers? Do you have any numbers for this, for the bereavement?
We will. I have information where people are offering these grief groups or like Blue Christmases. So I'll make sure I pass that information on to you.
Eugene. any information that you can share with us, we will share in the information and resource package that we send to all participants. Thank you so
Perfect.
much.
Yeah. I'll end with this. I invite all of you for a loved one to do a hug blanket. I do this with all my clients. So I thought I'd do one for my granddaughter. So it shows you don't need to be an artist. I'm not sure why I made the arms so big. I'm not sure why I gave elbows on both sides of my arms. The muscles are definitely not that big. The waistline is not that slim. I'm not, I've written a book, a lot of articles. I still don't know how to spell, but I think I nailed the glasses. And then whenever your loved one needs a hug, you can do this hug blanket. But what it has done to deepen relationships with the people that I've given this, that can be really helpful in dealing with that particular aspect. So when you get these slides, just look at some of the skills that can be really helpful. And I want to end with this. Brene Brown says, when we deny the story, it defines us. When we own the story, we can rewrite a brave new ending. My contact information will be on there. If you need to give me a shout or send me an email, feel free to do so.
Where is your contact information? It's not here. Is your contact information here? No.
Okay.
We will provide your contact Eugene's contact information in the information that we send out to you, and we'll highlight it.
Yeah.
Thank you. There it is as well. And
okay, hold on. 519.
Okay.
No, okay. 2116.
Yep.
Thank you so much, Eugene.
Okay.
That was a very helpful and engaging presentation. Thank you so much. There is one question in the chat that I just want to provide the opportunity for you to answer, and then we will go into a short break before we have our next speaker and presenter. So Catherine in the chat, but I've been talking with healthcare providers about their experience of COVID in long-term care. They talk about feeling triggered or trauma, yet it seems they are not seeking help. Do you have any advice on ways to encourage healthcare providers to process this experience?
Yeah, that's a really good question. And we're a tough group. I was very lucky. I always had an EAP program twice a year, whether I felt I needed it or not, I would go. I've been involved with a little over 13,000 deaths in the 43 years. And when I went, when I thought I was in pretty good shape, I found out I wasn't. So it was really quite helpful. So I really encourage most healthcare providers have an employees assistance program, making that call. If it's not a good connection, keep on going. And I say that to my new clients. Look, we might not connect. Feel free to find somebody else. That's our responsibility to do. I think it's really important. And the more you can do it face-to-face will be helpful. I know employee programs are trying to reduce costs, so they do it virtually, but once the restrictions are down, face-to-face is the best. I encourage our healthcare providers to create like reading groups where you get 10 of you together, each pick one article on self-care. And sometimes that can break down the barriers to say, I might need some more help. So you're right, we're the worst at trying to reach out and often need that the most around that particular aspect. Many nurses have not had a holiday in 2 years, and that's just not sustainable around that. And just dealing with the constant loss experiences, and then the fear of infection is always there around that particular aspect. So encourage maybe other supportive things that will open the door. Enroll in your own EAP program and share about it. It's a pretty risky thing to do, but I think it's that example. That's why I share that. And I was very lucky. I had the same therapist for 17 years. So she really got to know me, and it was so helpful in staying healthy, caring, and compassionate.
Thank you, Eugene. We're just going to finish with a comment that Mariana put in the chat. So it's really important to open up and get the proper support. It will feel like the load on your shoulders decreases. And thank you for a good presentation. So I think that's a really nice summary there from Mariana. Thank you so much, Eugene.
You're welcome.
And we appreciate you taking the time to come and present today. Okay, so we're just running a little bit over schedule. We'll try and get back on track. I see that Mariam, our next presenter, has joined us. We are just going to take a short break of around 5 minutes, give you a chance to stretch your legs, grab a drink, and then come back. So let's get started again at around 10:34. Thanks very much.
Bill, I'll stay on during the break if you wanted to chat.
Yeah, perfect. Thank you, Eugene.
Morning, everyone.